Hey guys, welcome to Pharmacy Tech Study Guide. This is your pharmacist Sidra and I'm here to help you prepare for your PTCB exam. In today's video, I'm going to talk about everything you need to know about control or scheduled medications. I'm going to cover types of control medications, their restrictions, refill and transfer laws. So get ready to take notes and answer the knowledge check questions I will be asking you in between the video. Be sure to write your answers in the comments and watch the video till the end to get the answers to the knowledge check questions. Okay, so what are controlled substances? The medications that can cause physical and mental dependence are categorized under controlled substances. The DEA, which is Drug Enforcement Agency, works with FDA, Food and Drug Administration, to make the decisions about the schedule in which a controlled drug is placed based on how likely it is to cause dependence. Now, throughout USA, a drug may not have a same drug schedule category because the states have their own authority to classify drugs in a stricter category. For example, gabapentin, which is a medication used to treat nerve pain, per federal law is not a controlled medication, but is considered controlled medication in some states. Now remember, state laws may not be weaker than the federal law requirements, but they can be stronger or they can be stricter. What is the brand name of gabapentin? What is gabapentin used for? And what is the drug category of gabapentin in California? All right, so let's talk about the classification of scheduled drug. There are 5 scheduled classes based on the abuse potential of the drug. It goes from control 1 to control 5. Now, I want you to pay attention to my next sentence. Higher the schedule number, lower is the abuse potential. I'm going to repeat. So higher the scheduled class of the medication, lower is going to be the potential for its abuse. So that means Schedule 1 substances have the highest potential for abuse. Therefore, currently in USA, there are no federally accepted Control 1 medications that are used for treatment purpose. So drugs in this category, such as heroin and LSD, are not really available to any pharmacy, but they may be used in labs for research purpose. Now, these medications are commonly used illegally or unlawfully. Marijuana, however, is an exception. It is a Schedule 1 drug according to DEA and is legal for medicinal and recreational use in many states, but is available only at the marijuana dispensaries, not common pharmacies. So as a general rule, none of the Schedule 1 drugs are dispensed in pharmacies. Now let's talk about Schedule 2 drugs. Schedule 2 drugs and substances also have a high potential for abuse. They differ from Schedule 1 in that they are accepted for medicinal use in treatment with severe restrictions though. Like Schedule 2 prescriptions cannot have refills, they cannot be faxed or called into a pharmacy. They have to be sent via electronic script, or a patient can bring in a paper prescription which must be on a secured blank with a special barcode on it, which may be used to actually track the hard copy. The patient cannot bring in a plain piece of paper with a prescription of a C2. Now, the only time a Schedule 2 prescription can be phoned in or faxed is if it's an emergency use prescription for hospice patients, which are terminally ill patients. In this case, the prescription must indicate 11159.2 hospice exemption. The prescriber must follow the phoned or fax prescription with a written prescription within 7 days. And if the prescriber does not send the written or hard copy prescription within 7 days to pharmacy, then the pharmacist by law is responsible to report it. Also, Schedule 2 prescriptions currently cannot be transferred to a different pharmacy. If the pharmacy for some reason is not able to fill the prescription, then the doctor must cancel the prescription at that pharmacy and send it to another pharmacy electronically, or just, give the patient a hard copy so the patient can take it to the other pharmacy. Another thing to remember is that a Schedule 2 prescription is not valid if it's not signed and dated by the doctor. And let's say if the doctor forgets to do so, then this is one thing the doctor can't rectify over the phone. The provider must send a new prescription which is signed and dated, or send the prescription electronically. Now let's talk about what medications are Schedule 2. Generally speaking, all opioids like Norco, Percocet, and also all of your ADHD medications like Adderall, Concerta are classified as Schedule 2 medications. These are the top 200 medications, so I highly recommend that you memorize their brand and generic names. I have listed the commonly used opioids and ADHD medications in my top 200 videos, so refer to them for the list. It's a two-part lecture in which I have categorized the drugs by their use and drug class, so it's super easy for you to remember. I'll put the link of the videos in the I button, also in the description, but make sure you do remember the top 200 medications. You cannot skip those for your PTCB exam. All right, moving on to Schedule 3 drugs. These medications have a lower potential for abuse than the Schedule 2 substances, but the abuse may lead to moderate or low physical dependence. Now remember, the life of all controlled prescriptions is 6 months, while the non-controls is 12 months. Schedule 3 and Schedule 4 have the same refill restriction. They can have 5 refills in 6 months or 120 days worth refill, whatever comes first. These prescriptions can be faxed or called in, but the pharmacy must do its due diligence to verify that the called in or faxed prescription is not forced. A real doctor is actually calling in or faxing those prescriptions. Now, some of the examples of the Schedule 3 medications are Suboxone, Tylenol with codeine. Now, codeine is a trick drug when it comes to schedule classification because its control category changes depending on its formulation. For example, it's a Schedule 2 if it's prescribed as a single agent, like codeine by itself is a C2. However, it's Schedule 3 when it's formulated as a combination product like Tylenol with codeine. But here's the trick part. When it's formulated in combination with a cough syrup, like in a liquid form, like Vertacin AC, then it's considered as Schedule 5. Knowledge check question 2. A doctor calls in a prescription of tramadol 50 mg to be taken as 1 tablet every day. How many refills can this prescription have? Option A, 5 refills. Option B, 4 refills. Option C, 1 refill. Option D, no refill. Alright, so next up are Schedule 4 medications. These medications have lower potential of abuse compared to Schedule 3. But just like Schedule 3, these medications can be refilled if doctor authorizes on the prescription. Now again, each prescription may only be refilled up to 5 times within 6 months after the date on which the prescription was issued, and after 5 refills or after 120 days total supply of the refills, whichever occurs first, a new prescription is required. Now, common Schedule 4 medications include benzodiazepines, which are anti-anxiety medications like your Xanax, Klonopin, also Valium. Again, you can check the complete list in my top 200 drugs video. And lastly, we have Schedule 5 medications. Now, according to DEA, the medications in this schedule have a low potential for abuse relative to those of course, Schedule 4. There are no special restrictions on refills for Schedule 5 prescriptions. Example of such prescriptions could be Robitussin AC, which is also called Vertacin AC, or other cough medications with codeine. Another good one would be pregabalin, which is generic for Lyrica. Vimpat, which is a seizure medication, is another common one. Codeine is a Schedule 2 medication. A patient brings in a prescription of Tylenol with codeine number 4, 300 mg/60 mg. What is the schedule category of this medication? Option A, Schedule 3. Option B, Schedule 4. Option C, Schedule 2. Or option D, it's a non-control. Alright, now that you know all the categories of the scheduled medication, it's important that you should know how to handle controlled prescriptions. See, the laws around the controlled medications are made to protect people from harm that these drugs can do. Because these medications have abuse potential, like these are habit forming. So by law, these prescriptions must have specific information on them to be considered valid. So whenever you come across a controlled prescription, you should always make sure that it meets all the law requirements for a scheduled prescription. Like it should have patient's name and patient's address, date of birth, drug name, drug strength, quantity prescribed. The doctor should have indicated the number of refills. There are a number of other things. I'll actually put the complete list on the screen so you can see all the specific requirements of the prescription. But most importantly, if the patient drops off a prescription for scheduled medication, always make sure that it's signed and dated by the provider. And if you notice any other information missing on the prescription, like the number of refills are not marked correctly, the quantity is missing, that's not a problem. You must let the pharmacist know at that point, so the pharmacist may contact the provider for clarification. All right, so last but not the least, I want to talk about the partial fill of the scheduled medications. This is a common question that a lot of people get confused about, so let's give it a minute. Now, a pharmacy can do a partial fill, meaning dispense less quantity than the amount prescribed on any prescription if the full quantity or amount is not available. Now, Schedule 3 to 5 medications can be partial filled as long as the refill does not exceed 5 times within 6 months of the original prescription date. However, the Schedule 2 medications, if the pharmacist chooses to do a partial fill, then the pharmacist must make a note on the written prescription or the electronic record, however the prescription is available, and make a note of how many tablets or capsules were dispensed. And according to the Controlled Substance Act, the pharmacist must provide the completion quantity or the remaining quantity on the prescription within 72 hours of initial allocation, after which the prescription is no longer valid. In that case, the pharmacist must contact the provider and let the provider know that the pharmacist could not fulfill the remaining quantity, so a provider needs to send a new prescription. Now, partial fill of Schedule 2 for hospice or terminally ill patients can also be done. Again, in this case, the pharmacist must document on the prescription the initial amount that has been dispensed, and the remaining portion of the prescription in this case has to be fulfilled within 72 hours. You have a longer window, which is 60 days. So the remaining quantity or the completion quantity must be filled within 60 days unless the prescription is terminated, because in case of hospice patients, probably the medication is no longer needed. All right, so this is it for today's video. I hope you answered all the knowledge check questions I asked. Now let's find out if you got the answers right. Here on the screen, you can see I have the first knowledge check question. The question was about the name brand of the gabapentin, its used, and the control category. So the right answer is the name brand of gabapentin is Neurontin. The medication is used to treat nerve pain, and this is considered non-controlled medication in California. So for question 2, the option C is correct, which is 1 refill. On question 3, the correct answer is option A, Schedule 3 class. Congratulations to the ones who got the answers right, and if you did not get the answer right, don't give up. Watch the video lecture again and maybe pay a little more attention. And if you still don't get it, don't worry. Leave your questions and queries in the comments and I'll be happy to help. Thank you so much for watching today's video. I hope you found it helpful. If you have any questions, leave them in the comments or just email me, and I'll see you next time with another video on Pharmacy Tech Study Guide.